I'm glad you came in today. I think physical therapy is going to be very beneficial for you. Some of the impairments that we found in your low back seem to be due to some added pressure that's happening at a disc in your spine. And sometimes when this happens, it causes some irritation to a nerve that's running from your spine down the back of your leg. And if you recall earlier when I had you do those standing extension exercises where you had your hands back on your low back and you pushed your hips forward and leaned back, it helped with your leg pain. Well, this happens because it's taking that pressure off of that disc, which is taking away that irritation that's happening to that nerve. That is one of the exercises that I would like you to do at home if that is okay with you. Another exercise that I would like you to do at home is called a prone press up. And the way that you can do this is that you're just gonna lay on your stomach, either on the floor or on your bed, whatever is more comfortable. And you're gonna start with your hands on the floor, your elbows to your side like this. And then as I want you to make your elbows and arms nice and straight, and then lean back, holding it for a couple seconds, and then just coming back. And I have a handout with pictures of these to help you that I will give you at the end. But if I can just see you do a couple reps right now, just so I can check your understanding. That looked awesome. Another thing that I think therapy can be very beneficial for is called manual therapy. I did it earlier as well when I put my hands on your low back and I was just pressing there, and it helped with your symptoms as well as some mobility. We were able to touch your toes a little bit more, and it helped with your leg pain as well as your back pain. This is also happening because I'm taking that pressure off of that disc and just opening up that space. And another thing here in therapy that we can do is help strengthen the muscles in your low back as well as your abdomen to help this, to stop this from recurring again. And I know since you sit a lot for your job that it's going to be very important for us to strengthen all those muscles to keep this from happening. And I know you have some concerns about why you're having low back at such a young age, but I do want to assure you that having low back pain is very common, and this issue usually resolves in 1 to 2 months. If you are adherent to the exercises that I give you and coming to therapy, it should resolve in that time frame. I know you're also worried about continuing to work. I want to assure you that you can continue to work, but I do want you to be aware of when your back starts to hurt and in what certain position it does hurt, just so you can let me know next time. When you are on those trips and you are driving a lot, it is okay to stop and get out of your car like you were doing before and doing some of those standing exercises where you just lean back, taking away that pressure again. And the longer you come to therapy, the more I can build up that strength and those back muscles again to keep this from happening. I am a little concerned about your high blood pressure, so I would advise you to go see your primary care physician. I am also going to be giving them a call as well just to follow up on that. But if you do not have any other questions for me, then awesome. Here is your handout, and I will walk you out to our scheduler so you can schedule to come to therapy. Thanks.